You know, during the campaign, you were referred to as 41, the reference being that if you were elected, you would be the 41st Republican in the Senate and put an end to the Democrats' supermajority. And you said that you'd like to be the decisive vote to block health care reform. So is that #1 on your agenda when you get to Washington?
No, the first thing I'm going to do when I get to Washington is go and meet everybody, both Democrat and Republican.
But once you get done with that.
Well, once I get done with that, whatever bill comes up, I'll look at it and make my own decision. But if 80% of our people insured here already in Massachusetts, we do not need the plan that's being pushed upon us. We would have lesser care, longer lines, and pay higher taxes, and it makes no sense.
You know, there has been some discussion the Senate could vote on health care before you are certified. Do you feel they have an obligation to wait until you are in the Senate to take up the issue again?
Well, I'm obviously, that's up to the leadership in the Senate. I think, though, if they use some political chicanery and they do it without having to go back and forth with proper votes, I think coming the midterm elections, people will be very, very concerned, and they'll remember.
You know,